Hello and thank you for watching. This video will discuss CAMBRA, what it is and why you should implement a CAMBRA protocol in your practice, along with the tools to help you get started. So first off, what is CAMBRA? Well, CAMBRA is an acronym that stands for Caries Management by Risk Assessment, and it's a protocol to manage and prevent dental caries through risk assessment. CAMBRA began in the early 2000s at the UCSF School of Dentistry with Dr. John Featherstone and his team, and it's supported by the California Dental Association Foundation. According to the American Dental Association and the American Academy of Pediatric Dentistry, the new dental standard of care for managing a patient's risk and preventing dental disease is to perform an individual caries risk assessment analysis during dental appointments. We have all experienced a similar risk assessment when we visit the doctor for a physical exam. When assessing risk for heart disease, for example, the physician will test blood pressure and do a cholesterol count. They will also address risk factors such as age, gender, tobacco use, weight, diet, activity level, and so on, along with other disease conditions. Based on their findings, the physician will make an individualized recommendation. Recommendations for a person at high risk for heart disease will differ from those with a low risk. The same goes for caries risk assessment. We will be looking at risk factors such as dry mouth, medications, frequent snacking, poor home care, and oral appliances, as well as disease indicators and protective factors. Here at CariFree, we've created two different programs that follow the CAMBRA protocol. We're a company founded here in Albany, Oregon by Dr. Kim Cooch. We manufacture a line of caries prevention products that includes tooth gels, oral rinses, mouth spray, gum, and lollies. We also have a caries screen test that measures biofilm activity levels. Our mission as a company is to educate the dental profession on CAMBRA and stop the dental caries epidemic. Our first program is the Screening and Treatment System. This program uses the Caries Risk Assessment, or CRA form, to gather 3 data points, including risk factors, disease indicators, and biofilm challenge. The biofilm challenge is a score given by the Caries Screen Meter that measures biofilm activity levels. Using this information, you will be able to determine your patient's caries risk level on a scale from low to extreme. You will then use the Caries Management Guide to determine the proper therapy recommendations and treatment products for your patient. The second program is the treatment system, which includes only one form and does not incorporate the Caries Screen Meter. This is a simplified version and focuses on disease indicators to determine a patient's caries risk. Both systems are designed based on statistical CAMBRA population studies. The screening and treatment system provides a complete assessment of each patient's risk for future decay. Patients that have gone through the process understand why they are at risk for caries before symptoms present. The treatment system provides a practice with a simple caries management program designed around assessing and prescribing therapy based on the presence and incidence of decay. With both systems, practices can monitor patients' progress and make changes if necessary. Patients that accept therapy and lower their risk are often motivated to share their story with family and friends. There are many benefits to implementing CAMBRA. However, there are also some things to consider. Often practices struggle initially with their confidence in the diagnosis when the statistical risk of a particular patient does not align with their dental history. Practitioners also need to be willing to take time to learn how to navigate these types of situations. Also, if CAMBRA is to be implemented for all patients, then the team must be willing to dedicate both time and effort to things like trainings and team meetings, and must also be willing to evaluate their program along the way. Something else to be considered is that the entire process typically takes between 3 and 7 minutes per patient in each appointment. Implementing a CAMBRA protocol is ideal for those practices who believe the benefits outweigh the challenges and are serious about offering preventative care. For more information about CAMBRA, please reference the book Balance. It's a guide for managing dental caries for both patients and dental professionals. You can find additional information on our two systems and our product line at carifree.com. If you have any questions or would like to receive a copy of Balance, please contact us at 866-928-4445. Thanks again for your time. Have a great day.